Welcome back. The White House announced yesterday that President Donald Trump has been diagnosed with a condition called chronic venous insufficiency. It's something that they're calling benign and common, especially for someone the president's age. Remember, he's 79 years old.
Yeah, and so we wanted to take a deeper dive, of course. This is the president we're talking about. So we brought in ABC's medical correspondent, Dr. Darien Sutton. Doctor, thank you as always for coming in. We want to talk about this condition because it's the president, yes, but how does this relate to others? You know, obviously there's a lot of concern with that. And how is it diagnosed?
Yeah, so this is a very common diagnosis. Up to 40% of adults, especially those over the age of 50, even older, have this diagnosis. I see it often in the emergency room, not from patients coming in with the complaint of the specific diagnosis, but with the complications. Most likely swelling, for example. Sometimes it can lead to skin breakdown or ulcerations, or even skin infections like cellulitis, and even in severe cases, blood clot formation. So it's so important to understand what this is, mainly to understand how you can prevent it, but also be aware of those risks and complications.
Totally.
I feel like we're only talking about it because of viewers who saw, and on social media, who started seeing things that they wanted to know what it was. Right, the picture of the skin on the hand, the picture of the swelling in the ankles. And when you say this is common, and now at my age, I start to have friends that are over 70, and I know that it is, but is it just this? Is that all it is, and it's fairly common, and what do we do if we have it?
It's a great question. At the base of it, it's a circulatory system issue, specifically with the veins, and the veins are in charge of returning blood back to the heart. And so when there's an issue with veins, that leads to pooling of blood, which then leads to swelling, and that affects most areas that are affected by gravity, which is why the legs are most commonly affected, but it can affect the entire body. And so in terms of understanding what this is, it's tightly associated to certain lifestyle factors, for example, sedentary behavior, obesity, overweight. These are certain factors, but there's also a genetic component. Overall, this is a condition that many people have and just simply don't know about it. We understand that the president underwent significant amount of tests, blood testing, ultrasounds of his veins, his arteries, and his heart, and that is how they got to this diagnosis.
That's what I was curious about. Is this a sudden diagnosis, or would there have been things leading up to this? Because every time we've read a medical report from the president when he was campaigning, his doctor said, the most fit president ever.
Healthiest person in the world.
Person. I mean, they said it's so. Is this a sudden change that, oh, today, boom, he just has this? Or
this is a slow progressive problem, and with that, there's no curative treatment or intervention. Often it is underdiagnosed or missed, just in general, because patients don't normally complain about it. And it's not as if there's a specific test, it's more of a diagnosis of exclusion, meaning that you test for all the other things, and when those are negative, then you likely will land on this diagnosis.
And his administration says that he has not complained at all about pain, and you do see him, he's moving around a lot. He's in a lot of places.
So if someone at home says, hey, my ankles are swollen, hey, the skin on my hand, what do they do? Is it something they have to go to the hospital for, or are there subtle changes they can make at home that will improve it?
Well, there's certain activities in terms of making sure that you're being active with your lifestyle. The American Heart Association, for example, recommends that we get at least 20 to 30 minutes of physical activity a day.
Move, right?
Movement is key to life, but also our diet. But in general, if you have swelling in your legs, that's something you should bring up with your provider. That involves a full workup. There are many different causes, which is why as physicians, we try not to speculate when we see headlines of signs or symptoms that people might have. In terms of being 79 and being the president, that is a very strenuous job in general. So having this condition can certainly slow you down, but it is more likely to be monitored rather than interrupt.
Okay.
all right, perfect.
That's
Dr.
great.
Darien
I
Sutton.
mean, I feel like I understand a lot more about it. And I think it's good that we have these conversations, because when people are highlighting all of this on photographs now in the world of social media, you want a factual basis of what's going on.
And we jump to conclusions, and you're right. We shouldn't do that.
There are many different causes to these types of symptoms, so it's always important to take a step back. You don't know what shoes people are walking in.
And for a White House who has complained about the health of other presidents, they need to be forthcoming with this information, and I'm glad they're talking.
A vital part of national interest to understand the health of the president.
Absolutely.
Dr. Darien Sutton, thank you so much.
Dr. Sutton.